welcome to the Fairly Relatable podcast.
It's like therapy with your best friends, minus the copay.
Hey guys, welcome back.
Hi.
Thanks for listening to the last episode.
I'm excited for this episode.
Yeah.
I think it's a very important topic to dive into, and I think it's something that's super prevalent in a lot of people's lives to varying degrees. So
super relatable.
Well, we're fairly relatable, but this one's super relatable. We're going to be talking about
anxiety,
that little beast.
Yeah. So,
and also for this one, we're going to do more of a kind
of like psychoeducational.
Yeah.
Because I'm a therapist, licensed marriage and family therapist, and I just wanted to give a little bit of information about anxiety. It's like, this comes up everywhere. Personal life, work life, everybody deals with anxiety to some degree.
My dog has anxiety about separation.
Yeah. I mean, I guess we'll just kind of jump right in. Anxiety, it's a good point you're bringing up. Anxiety is sort of like the issue, but it manifests in different ways. So clinically, when we think about anxiety, there can be sort of this underlying predisposition for anxiety or whatever. It can go into generalized anxiety. It can go into social phobia. It used to be called social anxiety disorder. Now the new DSM calls it social phobia. It can go into obsessive compulsive disorder, panic disorder, but really it's like anxiety is the root issue of all of it. So I try to explain to clients, anxiety, it does kind of get a bad rap.
As it should.
As it should. Here's the thing. Just like all negative emotions, I'm doing air quotes if you're listening, negative emotions, society, they kind of like society deems them as negative. They do tend to get a bad rap because all feelings, especially the negative ones, they do serve a purpose. They are adaptive. That being said, when the anxiety is so excessive that it's now to our detriment in some way, if it's interfering with work life, social, academic, all that kind of stuff. Once it starts to cause impairment, like problems in functioning in those domains, that's when it becomes an issue.
So you believe, and maybe you won't know these people from your clientele because they wouldn't become clients, but there are people out there with a healthy dose of anxiety?
Yes. Anxiety.
What would that look like?
Well, so let's say we were just talking about the Olympics. These Olympians, before they go perform, or whatever we want to call it.
Yeah.
I'm sure they feel a little bit of anxiety.
Yeah. Watch Simone Biles. Yeah.
Right. But when channeled appropriately, anxiety is adaptive and it's actually helpful. It literally sharpens our acuity, right? We're able to really dial in. It does have a benefit. If no one ever felt anxiety, I don't think we would be able to accurately perceive threat. Back in the day, the threat was like a lion, right? We always use that one, So you have to have a little bit of anxiety. Anxiety in and of itself is not a bad thing. But again, if it's excessive, it's a problem.
So you just said that it helps you. What did you?
It sharpens acuity. It helps with focus.
So I think that's interesting because I feel like it does the opposite.
Right, because yours is probably excessive. I'm going to go out on a limb here. Right?
Yes.
But think about taking an exam. A little bit of anxiety, it helps you get kind of dialed in and you focus, and it's it can be used as like a motivator almost.
So that's how you have a healthy amount. Your life isn't being interrupted.
Yeah, you're not lost in it. It's not so severe that it's does the opposite, where you're almost feeling kind of foggy or kind of like you're saying the opposite of really sharp attention. If you're feeling oh my gosh, I can't make sense, I'm just kind of lost in it. That's not good. It's not helpful.
And with that healthy anxiety, I would imagine it shows up in those moments, but when those moments are done, it dissipates.
Yes. Yes.
Okay.
And there is a benefit to planning for the future. And a lot of that involves anxiety at times, right? Like it's helpful to look at the past because we want to look at, okay, glad I did it that way. That worked out. Awesome. Not stoked I did it that way. I'm going to do it different. I'm going to course correct, right? So there is, again, it is adaptive. Like even regret is adaptive because we can look at, okay, now I'm motivated to do things different. And then looking into the future, we're always in the past or the future. Like we're rarely just in the moment.
Man.
I know.
It's so true.
I know. So when we're looking to the future, there can be anxiety. And again, a little bit of it can be channeled in such a way that it works for you. Like it's helpful, it's adaptive. And then I also like
That
to
was
explain.
a very good eye roll that you did for anyone that can't see her. She was just,
Because it's just like anxiety, man. It's not pleasant. I mean, I've had everyone feels anxiety from time to time. It's a normal human emotion, but my anxiety years past, and we can get into that if we want. It came out in like social anxiety.
social for you.
You know, I would turn like bright red, especially if I was approached by like an authoritative figure. My heart palpitation.
You would get red hives. You would get red blotches.
Yes.
Yeah, I haven't seen those in a long time, actually.
Right. Well, now I'm on the estrogen blocking meds, and I think the hormones played a big role in that too. You know, so like there's like the neurotransmitters, the dopamine, the norepinephrine, the serotonin, all that stuff that does the mental health stuff. But then there's also hormones that contribute to anxiety.
I am gonna just say I haven't had any of this confirmed, but I think because I feel like my anxiety lately has kind of taken on a mind of its own. And I think part of this is hormonal. Perimenopause.
Yes. And now that I've gone through menopause chemically because of the breast cancer and I have to be on the estrogen blockers, I have so much less anxiety.
Do you?
Yes. I feel so much more balanced and stable now that I don't have estrogen.
Okay, wait. So do you think, because you know how we've been talking about over the episodes, how you just kind of like don't give two fucks about so many things.
Mm-hmm.
Part of that was your life flashed before your eyes.
Right. And having kids and all that. Yeah.
Yeah.
And the breast cancer.
Well, that's when it made like you were shown like what really matters. Do you think it's also
the hormone? Yeah. Yeah. So that's a good point. I don't know to what extent. Yeah.
It's like a perfect little
which came first, chicken or the egg, but
at what age? I mean, when does that all?
I think it's different for everyone.
I think it is too, but when did I become of this age? I don't know. Another topic.
Of this age. When did I become of this age?
Where I was 27.
Yeah. But so here's the thing with anxiety. It's almost like there's a good analogy. It's like a fire alarm, right? So fire alarms are there to detect threat.
Yeah.
And it goes off when there's a threat. Sometimes there's false alarms.
Yeah.
And it goes off when there actually isn't a threat, but we just like think there's a threat.
Okay, yes. So much of like at least the anxiety for the way it manifests in me is trying to come up with what the threat's going to be. So I'm prepared.
Like anticipatory.
Right. Like catastrophically what can come. And then I ruminate on it. So now I'm living it. If it happens, I'm living it twice.
That's such a good point.
Right. Yeah. Like, so I'm living it now in my brain and then I'm going to live it when it happens. Or it's not going to happen, but I've made myself miserable for such a long period of time, ruminating over it happening. The irony is when something that I'm worried about actually happens, it comes from a direction that I never saw it coming.
Right.
So I'm not prepared, but I definitely, a lot of my anxiety is in my head about what if this happens? What if this happens in lots of different parts of my life that you know about that I'm not going to talk about, but it almost like causes you to just like freeze.
Yeah.
Yeah. Well, fight, flight, or freeze.
Fight, flight, freeze, or fawn.
What's fawn?
Fawn's a new one. It's like when it's almost like you go into like placating and people pleasing.
Oh.
But
yeah,
you know, and then you're bringing up, I mean, there's so like, I feel like it's going to be a 7-hour long, like there's thoughts, but our belief system, our self-talk, whatever we want to call it, that cognitive piece, the thoughts, whether it, the cognition, whether it's a thought or an idea or a memory, it's whatever's going on in here, that is going to like basically dictate how we're feeling. So you were talking about the what ifs. There's a list, and everyone can look this up. They're called cognitive distortions. It comes from the cognitive behavioral therapy model. There's like 17 to 20 of them, depending on what, paper you're looking at or what site you're looking at. But the what ifs is one of them. It's what if this happens? What if it doesn't work? What if I fail it? What if they don't like, blah, 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 blah. And then in terms of what to do about it, which, I'm kind of bouncing, I'm kind of ahead, but I'm just going to say quickly, but for the what ifs, we would look at what if it doesn't go that way?
But then if I live in that, I'm going to give you an anxious person's brain, right? What if it doesn't go that way and I take that point of view, but then it does?
I mean, it's a good point. And truthfully, so a lot of our thoughts are negative. They've done studies. I think it's like 90% of our thoughts are negative, right?
Yeah.
Most of our negative thoughts are distorted. They're not even accurate. So I tell clients, look, sometimes our thoughts are true. I'm never going to be an NBA player. I'm just not.
Don't count yourself out.
Thanks, Jess.
Change your self-talk.
But you know what I'm saying? Like, some of our thoughts are accurate, but for the sake of our discussion, we're going to look at the ones that are not accurate, that are distorted.
So many of them.
If it were to, let's say, the what if, maybe it does happen, but maybe part of the negative thought before it happening is it would be the catastrophe. Hopefully you listened to the previous episode. I'm like really hungover today. Anyway, part of it, it's like, a part of the negative thought that's contributing to the anxiety is if it did happen, it would be the worst thing that would ever happen.
But like, really, how bad could it be?
Exactly. That's the distorted part.
It's almost like you can take yourself like, what if this, what if this, what if this? But then it's like, where you don't go is, okay, what if it does? Like, what's the worst that can happen? And then you can almost calm down because you're like, well,
that's the vertical descent technique.
But well, look at that
we used out front earlier. Remember when we
yeah. And then when you think about worst case scenario, you're like, well, it would suck, but
I would survive. And again, this is not, I'm not talking like life-threatening situations, right? We're not talking about that.
No. We're
talking about like, if I don't get this job, it is literally going to be the worst. And we just spiral on it, right? What if I don't get it? And it's going to be the worst thing. Well, what's worst case scenario? I don't get the job. Okay, then what? Well, I mean, I have 2 other places I could apply. I'm not talking about me, but this is hypothetical. But you know what I'm saying? It's like, there's that train of thought. It's like, well, okay, I could apply at such and such place. We can look at our options. It's usually not going to be as catastrophic as we anticipate. And sometimes the anticipation, the anxiety
is worse than
the freaking outcome.
It really
is like worse.
I know I lean this way a little bit more than you do, but I also think the negative ruminating, I do think there's been so many things that I worry about so much. I manifest that shit. That it shows up. It might not show up for 6 months. It might not show up for 9, but a lot of the things that I throw out there, they do come to fruition. So whether it's intuition, like I pick up on a vibe or I pick up on an energy, because I feel other people's energy really strongly and really quickly. So whether I can like feel the way something's going and then it comes and then I get anxious about it and then I see it in 6 months or not, I always think like, well, what if I like ruminated on something so positive happening? But well, it's still, and we tried to do that. I think we all try to do that, but our brain just automatically defaults.
For a lot of people, anxiety is the frequent flyer feeling. We all have like mine's anxiety, yours is anxiety. For someone else, it could be anger, right?
And then I know it's a crazy number. I don't know if you know it, but like how many thoughts do we have in one day?
Oh, I don't know.
And then do you have your phone?
Yeah.
Look it up because it's some crazy number. And then if 90% of those are negative, and you think it's so easy, like I just have to change.
How many thoughts does a human have per day?
You just have to like change that narrative, but it just
approximately 60,000.
Yeah. Right. So what's 90%?
90% of that is negative. But I want to circle back. You brought up something I wanted.
Oh yeah. I thought I thought you meant like you were going to tell me what 90% of 60,000 were. And you're like, it's a
No, I
negative
failed
number.
freshman year math in high school. You were talking about it's like the what causes what.
Yeah.
So it could be that you just have a sense. It can also be this is how it works according to cognitive behavioral therapy. That is like the most widely used therapeutic model in psychotherapy because it's really good at what it does. There's a lot of evidence. They've done a lot of studies, and it's just good. The interventions are good at what they do. But according to CBT, cognitive behavioral therapy, our thoughts impact how we feel. I don't know if this is going in the right direction, but our thoughts basically dictate how we feel. That in turn impacts our behavior, what we do or what we don't do.
Right.
So if the thought is something, that's like an anxiety provoking thought, whatever it is, and then that's making you feel anxious, right? Your behavior is going to reflect that whole process. And you will probably just, because this is the way it is, you're then going to engage in behaviors that make you more likely to end up in the bad outcome. You know what I mean? I'm kind of not smart today, so I'm like dumbing it down.
No, I understand
Do you know
what
I
you're
mean?
saying, but I don't even think it's your thought dictate. What were your things?
There's always a belief.
No, I know,
always a
but what was your
thought, feeling, behavior?
So for me, I think it's more thought, feeling, the energy I put out. Because I think I can do the right behaviors. Because
that's behavior. How are you putting out the energy?
Even if I'm doing the behavior that should be done, the energy I'm bringing to that behavior is off.
But that's behavior too.
Energy's behavior.
I mean,
Isn't
we can make an
more of
argument.
action?
Well, we can look at it like this. So let's say I have a thought. Okay, the situation is I'm going to go to a big party. The thought is no one's going to like me. No one's going to want to talk to me. People are going to judge me and think I'm stupid. The feeling's going to be anxiety, maybe a little bit of depression, right? The behavior, what I do or what I don't do, I could avoid the party altogether, right? If I went to the party and did the right thing, like you're saying,
like say, hi, how are you? Make the conversation.
Yes. If your energy is coming out somewhere, it's coming out in your body language or your facial affect. Like, do you see what I'm saying? So
totally, in my mind, though, you're still like engaging with people and saying all the right things and trying to be a part of like the social situation. But if your energy is off, even though you're doing the behavior, it's not.
But it's going to be observable in some way.
That's what I mean.
Yes, behavior is observable. So,
but energy is observable. And
yeah, so it's kind of all the same.
Yes, I can
kind
see
of
that.
one and the same.
For me, I think behaviors are obviously a part of it, and but I think even if people are doing what you would expect them to be doing, if their energy is off, for me, that another person's energy makes everything stop and freeze inside my body. And I think that goes back to, you'll be able to talk about this, being a kid and walking kind of like wanting to make sure everyone's happy around you, right? However we grow up, whether it's family, friends, school, teachers, whatever, wanting to make sure, like reading the environment, kind of always being on high alert to make sure everybody's okay. And then you turn into an adult that you're super aware of like people's energies.
Yeah, like hypervigilant.
Yeah. And then sometimes you might get it wrong, but then you can stew on thinking someone gave you an off energy. Yeah.
Right. But again, that off energy is going to present itself as an observable behavior in some way. It just does.
Yeah.
So the goal is to really just challenge those negative thoughts, the ones that there's a chance they're distorted. You want to challenge them. You want to look for counter evidence, information that disconfirms the negative thought.
That's a part of CBT, right?
Yeah.
So I know there's a lot to go with CBT, but I think I think it's tricky because I think a lot of those techniques are really powerful and really good if you get somebody who's calm enough to couch themselves in those moments, and utilize the techniques.
Well,
but I think a lot of people, especially if they're really, really anxious or they're dealing with a really high stress period of life, it's hard when you're all wound up in those feelings to remember, at least for me, I've had a lot of different periods in my life where like calling on those techniques, I think about it like in a moment of calm a couple days later.
Yeah, and that's a good point you're bringing up. But part of the if you're like working with a therapist and they do CBT, part of the therapeutic process is going to involve the psychoeducation piece, helping you gain insight and awareness to like what are the cues, the internal cues in your body? Like how do you know when you're getting anxious? Like it's
That
all part of it. I love CBT, but I'll tell you what, since getting certified in EMDR, there is some shit that if we could have talked our way through it by now, we would have. Oh, so that's where EMDR comes in.
Okay, so that's what I was going to say to you. Like, does EMDR go to the subconscious?
I don't know.
Okay.
What do you mean?
So,
can you elaborate on that question?
I think I know so many of our beliefs are in our subconscious mind.
Oh, sure.
And you can't like CBT
Okay, I
can't
see what you're saying. Yeah.
CBT can't work on our subconscious mind. Like that keeps us in the conscious, but these core rooted deep beliefs, they're ingrained into our subconscious. So
And nervous system.
yeah. So I like taking approaches that bypasses the conscious brain. Cause like you said, if I could have talked my way out of it, I would have. Right. Like my parents, when they divorced when I was 13, no, I don't even know when I started, had my first experience with the therapist, but definitely around that age. But I would have talked my way out of it by now, right? But whatever goes on with any person, we all have some shit. It's in the subconscious. So I love and I'm so intrigued by these techniques that are kind of starting to bypass the conscious brain and just forget it. Like, let's just go straight into the subconscious.
I agree. But again, I will say a good therapist, the way to facilitate and enhance insight is your whole goal is you're making the unconscious conscious, the unconscious conscious. And a good therapist can help you start to pinpoint the unconscious because that's like 101, therapy 101.
I mean, this is actually really important, Kara, to talk about what a good therapist is doing because I've had in my own experiences so many therapists that you just go in, you just talk about
validate you.
You just talk about your shit. You not almost like you feel like if you've had a good week, you have to come up with a problem to talk about for your session. Otherwise, you're going in with nothing to talk about, right? So it almost makes you bring up these negative things if these therapists only want to talk and then like respond to whatever's happening right then and there. So I think what you're pointing in finding a good therapist is going to do this, this, and this. I don't feel like I've ever had a therapist that does like the psychoeducational part of it and really breaks it down so you have this like foundational understanding of what they're trying to do with you.
Yep, 100%.
So what else do we look for a good therapist?
Well, and again, to your point, a good therapist, if you were my client and whatever your treatment plan is, right? You're supposed to have treatment goals. In a perfect world, you have treatment goals.
Of course, you have
in private, in therapy. If the goal is to reduce anxiety, let's say, and you come in and you say, gosh, this was actually a really good week. Like things are going well. My anxiety was low. I wouldn't look for an issue. What I would do is say, what did you do different this week? What do you attribute that to? Like, what did you do more of? What did you do less of? And because you want to maintain the progress. It's not always about like, cool, your week was good. Let's dive into negative. Like a good therapist should be like, how is it better? Why is it better?
So I know I've talked a lot about the therapist I worked with most recently. Nice lady. She really was. But when I would say things like that, like not only would she validate my feelings 18 times a session and tell me what I heard you, like, I know what you heard me say.
Like I said
it. But if I said, I don't know, like not much has changed or things are fine right now, she'd be like, well, what about this? How's that part going? And what about this? But like she would dive into the negative stuff that I brought up and I just said everything's okay. So
personally, I think she could have probably done a better job.
Yeah, me too. That's why I stopped.
Yeah. Right. Good. I think first of all, the biggest predictor of success in therapy, it's not the therapist's education. It's not where they went to grad school. It's not the theoretical model that they operate out of, whether it's EMDR, CBT, or family systems, or solution focused, blah, blah, blah. It is the relationship.
Yeah.
Did you know that?
I didn't know that. It makes a lot of sense.
Yeah.
Do you think it's just as easy to build that via telehealth?
Yeah.
Because I know you do telehealth.
I do. And I had thoughts about telehealth when it all first kind of started. I thought like, I'm going to miss so much. I'm going to miss like the body language and the energy in the room. But I haven't really had any issues with telehealth. My clients are all really happy with telehealth, but I think it's like an interview. You want to meet with the therapist, and if you don't feel a connection, you got to find someone else. But I will say, as a therapist, I do care what model they use. I do to an extent. I don't want to, I might have a great connection with the therapist, but if we're not doing work, like then what? So it's like I almost don't like that statement that like the biggest predictor of success is the.
Do you like DBT?
I like it. I'm not well versed in it. I know it's a lot about like, accepting like two different, I don't even know.
I don't really know a lot about it, but I've heard a lot of people talk about it for being powerful.
It is.
I'm not just saying this because I'm biased, but I've never been one of your clients, but you've definitely been my therapist.
Oh.
And I know other people that you've helped me with different family members. If someone can get on your caseload if they need therapy, like do it. Like she's just
Thanks, Jess.
gifted, and you are like you're just really like I never want to abuse the relationship and call you every week, but and I know like ethically you couldn't be my therapist, but if you could, I would. Like you're very good at it. So if anyone
Thank you
needs a therapist, if you can try to get her, I highly recommend it.
Except I'm working full time now, and it
doesn't matter.
I don't really have any open slots.
No, you can
Okay.
fit them in. Okay, so for you, how did your anxiety present? And like when did you start to identify that you have anxiety? I do remember when we were young, it was mostly, not even most, maybe only social.
It was social, but do you remember, because we went to elementary school together, you and I?
I don't think we've ever told the story about how we met.
No, we haven't, and we should.
No,
but so my mom was the health clerk at one point. She was the health clerk at Ladera, where we
my mom was the computer
Oregon teacher. Oh my gosh, so and so died of diphtheria.
Speaking of anxiety,
oh my gosh, golly,
maybe that's why.
So anxiety provoking. Okay, so I would leave class a lot. I moved around a lot as a kid too, which that probably figures into the whole social and the whatever. But when I came back to California, I was in 4th grade. You and I met.
You didn't start the start of the year. You had to come in.
Middle of the year.
Yeah.
Didn't know anyone. You were like one of the first people I met. And but like 5th grade, 6th grade. 6th grade, I remember I would leave class almost every day crying and go to the office to just be with my mom. I've always been very, very close to my mom. And it started out as almost like separation anxiety. I just didn't feel safe. And I grew up safe.
No, I know you have a beautiful,
stable,
family,
healthy family. Not,
Do you think if your mom hadn't been there though, you would have been more resilient?
I don't know. I just know, I mean, I have flashbacks of even when I was like in 3rd grade in Arizona. I think I went to the school like a month. But I remember standing in the window. We were staying at a hotel because our house was being built, and we ended up moving back to anyway. So I'm standing in the window. My mom's going to Target, and I'm like, she's like pulling away, and I had been begging her, like, Mom, I want to go with you. I want to go with you. I want to go. I want to go. I want to go. And I'm standing at the window of the hotel, and I can see her pulling out of the lot. I see her turn back and see me in the window. She came back and got me. I've always just been, it's like a separation anxiety thing. I didn't feel safe in like, I mean, no shit. I didn't feel safe in 6th grade in class. There was, I just, the social.
Kara, where were we in 6th grade? Elementary school or junior high? Elementary school.
Yeah.
Who was our teacher?
I had Miss Winston.
I think I stopped remembering after 5th grade.
6th grade
what
is
did
kind
we
of
do?
a blur.
What did we do in 6th grade? I remember
outdoor
our
school,
5th grade.
Right? Isn't 6th
I
grade
loved outdoor school, but I remember
didn't.
we had missed.
I did, and I cried. I wanted to go home. Someone stole my camera.
I'm so
Someone
glad you
like
was
stole my camera, my little disposable, and I just cried. I wanted to go home. I wanted to be with my mom.
She called me a lot. Me too. God,
Yeah.
I hate. Oh, kids are.
I know, kids are mean.
That is crazy. I remember us in Mrs. Playa's class.
Oh yeah. Yeah.
But I don't remember 6th grade.
I actually liked 5th grade. I remember I didn't like 4th grade. It
We're
was really
very beloved
awkward.
by many. So the social anxiety.
I
But
don't
you
know.
did.
Yeah. And then as I got older, like 18, 19, 20, my social anxiety flared up. Like when I'd see my boss walking to my cubicle and he was so nice, I'd turn red, my heart, I'd start sweating. I started using stuff that makes you stop sweating. Like it was bad. I started taking Paxil, the SSRI, which is horrible, but anxiety dried right up.
Oh, so that's what I need.
Well, I wouldn't recommend. I'm not, I take Effexor now. I don't care who knows. I'm not like against meds, but Paxil is not.
I mean, that's a good.
My teeth still chatter. Like,
wait, your teeth still chatter, or
you can hear them.
That's what they used to do.
When I started taking Paxil, they started.
Why?
I don't know.
What's the
You
side
do it
effect?
like this. No, don't try to do it. Do your teeth chatter? Could anyone even hear my teeth chattering?
Wait, it was the side effect?
Yeah.
Oh my gosh. Okay, let's talk about SSRIs for a second. Because I don't think there should be any shame in taking a medication if you need it.
It's your decision.
I've been on so many different ones from a young age till now. I'm not on one now. Several years ago, I just started feeling like so foggy. I don't know if it's impacted memory, but I got off it. But I mean, I'm kind of really open to a lot. I'm scared a little bit to say it on here because if someone hears it and they're like, don't do it, I'm like, I don't want to know. Like, I want to just try.
Oh, right. Well, yeah, you gotta have, it's your journey.
But I tried microdosing psilocybin for a little bit. That one, I ended up going through a little over a year ago. Like, some personal stuff happened that was a really, really seriously hard time. And the psilocybin almost brings like your emotions to the surface and you have to deal with them and then it feels better. But like at that time I had to stop because I couldn't have the emotions at the surface. Like it was almost like my whole world kind of fell apart a little over a year ago. So I stopped it. I haven't tried it again since. But yeah, it's kind of just figuring everything out. And now there's a lot of talk about ketamine. So I'm thinking of exploring that. And that supposedly it's like I guess you take it like microdosing. I mean, not macrodosing. You listen to positive affirmations for about like 20 minutes and it's supposed to like help build new neuronal connections, open space in your mind, and then get into the subconscious and the beliefs start to change.
Ooh.
I'll let you know.
Yeah, I'm excited for you to be the guinea pig out of our friend group.
But I think there's a lot to be said with being okay with medication helping you if you need it, because it's really debilitating.
Well, it is. And like, look, if I get bacterial, if I have like strep throat, it's a physical ailment. I'm going to go to the doctor. I'm going to take an antibiotic and it gets better. If I have diabetes, I'm going to take insulin to keep my levels right. Like there's no difference with the psyche. Like the psyche, I think there's this like some people view it as they're these two separate things and they should be treated differently. And it's like, look, if they have looked at the prefrontal cortexes of, sadly, people who have taken their lives, and those people have significantly less serotonin activity in their prefrontal cortex. Like this is brain chemistry. It's not a choice. We're born with a predisposition. There's nature and nurture, of course, but like our life experiences, everything is part of it. But it's okay if you need to regulate your brain chemistry. Like it's okay. I don't understand this like stigma. I think people are more open to the recognizing that mental health is a thing at this point, but there's no shame in it.
Such a thing.
Yeah, there's no shame in it. I take Effexor. I tried tons of antidepressants. Some would really help, some wouldn't.
Effexor made me gain a lot of weight.
Really?
Yeah, it was like
I'm on the lowest dose. I'm on like
it was
the lowest.
I mean, it was years and years and years ago.
Yeah.
I think whatever works though, but yeah, I think there should be no shame in it because It is. It's like you said, it's literally brain chemistry. I think there's a lot of genetics composed to it. I think there's also a lot of generational trauma. Like, I mean, they talked about there's studies about it being passed down from like your great grandma, right? Then it's like through the egg, it gets like her trauma could be living inside you. And there's just so much to it. So whatever people can do, whatever works for them to help them.
Everyone's journey. Everyone's on their own journey.
It's super important. But I do think finding a good therapist to help you work through all of that is really good.
It is. And, you know, the research shows that therapy in conjunction with medication is like what's really indicated for really severe cases of like major depressive disorder, right? It's both. It's like,
go ahead.
Yeah, you can use the meds. You don't have to use them forever. You take them for just to get stable to where now you can actually benefit from therapy and be able to learn the tools and apply them.
Yeah. So it makes me think of my profession, right? If I have a child come in to work with me and we're supposed to be doing speech therapy, but they have behavioral things that they're working on, like I can't get to what I need to do until the behavior is a certain way, right? And it's helping a lot of families understand that, like, or if they're really shy, like I can't work on what I need to do until I build that rapport, and that rapport might take me 2 sessions or it might take me 6 weeks, right? But you have to have certain foundational things happening to be able to work on what you need to work on. For people with depression or anxiety, if you're dealing with it for a long period of time, it almost becomes your norm. So when do you think people know, or what do people look for to be like, okay, hold on, this is not okay. Now it's really impacting my life. Like, how do you know when it's crossed that line from functional and sometimes hopeful or productive to this isn't the way I'm supposed to feel, and this isn't the way I'm supposed to be having to deal with my day to day?
Sure. Certainly. I mean, clinically, there's indicators. If a person has anxiety and they're like having panic attacks,
right?
It's like, that's an issue. If the person's depressed and they have suicidal ideation or they're cutting or self-harming, that's there's an issue, right? But really, you want to look at, again, all those domains of functioning. There's like health, like physical health, social, academic, legal, occupational, familial. You want to look at all those domains. And if you're not able to go to school because you're so anxious, in the world of psychotherapy and psychiatry and all that, there is a diagnosis there because the symptoms are causing functional impairment. Their functioning is impaired. They're literally not able to get to school, or their depression is so bad that they're missing a lot of work, stuff like that. Or if the substance use is landing them in jail, then there's legal issues, and then their family members aren't talking to them. There's family issues, and then you just want to look at kind of all those domains. And if the functioning is impaired, you would get a diagnosis.
Yeah. I mean, and that makes a lot of sense. And those are really big. And the way I view those, like those are really stand out. Absolutely something's going on.
Super obvious. Yeah.
Super obvious. I wonder too, also though, about like when
subtle.
Yeah, like when someone's really anxious, problem solving decreases, creativity decreases. You can't really be creative or problem solve or have productive conversations if that anxiety is so high, and you're still able to like go to work, go to school, be in social situations, do all these things, but you're functioning on such a lower level because the anxiety is so strong. So I think those people need the diagnosis and the help as well, but they're still in the world presenting and looking like they're getting it all done, but they're limited in their skill sets.
Yeah. There's also the domain of emotional functioning too. Insurance is more like, we want to know how this is affecting their ability to go to work. But like there's an emotional domain too. So if you're so anxious that in the workplace, you're not setting boundaries with people, you're not advocating for what you need or what you want, that's to your emotional detriment, right?
And you're not able to do your job
You're not able to do your job.
Like even just the basics of your job because your anxiety is getting in the way.
That's legit. I mean, not legitimate. It's not the word. It's significant enough to where you would get like a formal diagnosis. But and I do explain to clients, getting a diagnosis, some clients like it. It's like, finally, there's a word for what I'm dealing with and I'm not alone, right? Other clients are like, I don't want a label.
Yeah.
I just say, look, to an extent, now a diagnosis tells us what we need to do. We know that people who have major depressive disorder tend to respond best to this type of treatment intervention. Okay.
Mm-hmm.
So the diagnosis isn't completely arbitrary because it helps us guide treatment and we know like what works according to research. But we can also look at it like it is a little arbitrary in a sense. It's like, let's just look at the symptoms and what we can do about them.
That's what I believe. I say whatever the diagnosis is, the diagnosis is. I think a diagnosis is most helpful if somebody wants to understand what's going on with them or if you're trying to build an insurance company.
Insurance, I was just going to say.
It's helpful for insurance. But outside of that, in my opinion, who cares what the actual diagnosis is as long as you're able to identify the symptoms and know how to treat
Exactly.
the individual.
Yep.
Right. Yeah.
Yeah. I have a pretty like
damn insurance
open
companies.
mind about, oh, dude, insurance companies are the worst.
I think they're criminals. I do.
I don't think you're alone in
whoever's
that.
at the top of that scheme,
I
taking
know.
everybody's money and then not covering their care.
I know.
Okay. All really, really good information. I'm sure there's so many more.
There's so much. I mean, we could do a whole other episode on like what to do with it.
I have a question.
Yeah.
If you think I'm thinking of adults and I'm thinking about people our age and for parents and then children have anxiety. Oh, and come on, COVID, right?
Mm-hmm.
There must be, and I see it I work with so many different children. I think there's definitely more anxiety in kids now post pandemic. So I think therapy for me for a child is an interesting thing because I see the benefit of it, but I also feel like if you bring a child to a therapist and they know that they're there because there's something not going right, it becomes a self-fulfilling prophecy. Like, I'm not okay. I need to talk to somebody because I'm anxious. Now I'm identifying as anxious, or now I'm identifying as whatever the word may be. And then that's how they're starting to see themselves so young. So maybe I don't know, but
what thoughts on that?
Yeah, go.
Again, a good therapist is going to generalize and normalize the kid and be like, there's nothing wrong with you for feeling anxious. We all feel anxious. I felt anxious earlier today when XYZ happened.
Mm-hmm. And then they
or I would tell a kid, look, if not a kid actually, but like a grown-up that's kind of therapy's off-putting to them, I would say, look, if your car's not working, you're going to take it to a mechanic, right?
Mm-hmm.
Unless you know how to do it yourself. Like if something's not working quite right and you're needing support, let's go where you can get support.
So what age do you think is like, for people who feel their kids have anxiety that's impacting their day-to-day, what is that path that you would recommend, or is it different for every child?
I think it's a case by case. Like it just depends. I think kids as young as I know clinicians who work with like 2 and 3-year-olds. It's never been my like forte. I'm more into like insight oriented therapy, but you can do play therapy, art therapy, right? I think it just depends. I think it depends. It depends on what's going on. 100%. Like if you get, you can give me like a more specific example if you want.
I don't really have any, but I know there's just a lot of families where the child's anxious or the child parent relationship is difficult. There's something called PCIT,
parent child
intervention therapy, I believe. And it's really interesting, like the parent and the child interact and there's a two-way mirror and the therapist is on the other side. I think that's a fascinating form of therapy, but I think there's just a lot of different,
I'm sure
really interesting ways that children present with anxiety. And I've seen parents come in with a lot of different approaches. And we've had a lot of parents ask us, what do I do? Who do I get help from? And there's a big list of people I can give them, but I really don't know. That's not my forte.
No, right? Again, it's just about finding like word of mouth referrals are always best for therapy, truthfully. You don't want to like just open up the yellow pages.
No, we actually have people come. So I have a team and I like us to all know who we're referring to. So we've had a good number of therapists come and like speak to us during staff meetings so we can kind of ask them questions.
Good.
Yeah. So we can ask them questions. It was always my dream at the start of the business is that we'd have a MFT on the team as well. Because like if the parents could get a
Yeah.
little therapy, the kid could get a little bit of
I'm
speech
having a
therapy.
hot flash.
Oh, here,
Sorry.
let me help you. Is it the talk of the anxiety?
No, it's my
Um,
my menopausal state.
But yeah, anyways, I think it's a big topic. I think it's an important topic, and I think that, I don't know.
It's a big, yeah. I wanted to say, you were talking about like with little kiddos.
Yeah.
For parents, I think, and I'm a therapist. I don't do this perfectly. So I'm not sitting here like, but I think validating your child's feelings
Mhm.
is like one of the basic, most effective, helpful things you can do.
Yeah.
You don't want to dismiss it. You don't want to invalidate it by like not paying attention to it, because then the child's going to internalize a sense of like, there's something wrong with me that I'm feeling this feeling. Do you know what I mean?
Right.
And then they internalize shame and all that. I think helping kids expand their emotional vocabulary. Like imagine
Mhm.
if you're feeling something and you don't know how to explain it with a word.
There's a great book set for this, like The Spot.
Okay. I've never heard
And
of it.
each book goes through a different emotion.
Ooh, yep.
It's super good.
That stuff is great
Yeah.
for kids. I mean, those are like basic building blocks. Like kids angry, let's say the kids, it's like, where do you, have them look at an outline of a human body. Where do you feel the anger in your body?
Mhm.
Sometimes they'll like color in the chest red or the fists red or what, just again, like the psychoeducation, giving them a feelings wheel. I know it might seem silly, but like, what are you feeling here? Or
Mhm.
the validation so important, and putting words to their emotional experience. Like, I'm so sorry that I know I was gonna say, I'm so sorry you dropped your ice cream cone.
Why is that funny?
I don't know. I don't know if I'd be like, I'm so sorry, but I would say something like, oh,
You would
I
say
know that's
something like-
such a bummer. I'm sure you're so disappointed. There's the word.
You're
They
like-
learn the word with the emotional
You don't
state.
think you'd be like, it's fine, let's go?
In reality, I would be in the middle. I really do try to be validating, but I'd probably be like, oh, that's a bummer. No, I know that's so frustrating or that's so disappointing. Let's get you another one. That's probably what I would do. I really do try though to put those. I want my kids to learn what am I feeling right now? What is the word that goes with it?
What if you can identify what they're feeling, you tell them what they're feeling, but you're like, but this is not
Important. You don't want to say that to your kid.
This is dramatic.
Well, this is one thing you can do. You can say, you teach what a boulder is. And you
Yeah.
teach what a pebble is. Is this a pebble problem or a boulder problem?
Yeah. It's usually when they're fighting with each other that you're just like,
let them have at it. My mom told me, she's like, I read somewhere, you got to just they got to figure it out. And then hands off.
yeah.
You guys
No,
figure it out.
seriously.
Work it out amongst yourselves.
Figure it out. No, I think I've heard that too. Just, all right, well, we'll figure it out one way or
But
another.
we got to do like a whole other episode on what to do with the anxiety provoking thoughts. If we want like to take a CBT approach, we could do a whole other episode on that.
Okay, let's do it. All right, well, that's it for anxiety for now. Now I'm going to
Thanks
be
for
anxious
listening.
preparing for the next one. No, I'm just kidding. Okay, we're good. Bye.
All right, guys, here's the deal. If you like what you hear,
And we know you do.
be sure to like, subscribe,
And write us a review.
that rhymes.